Prometric Q&A. Rationals. Pharmacological and parenteral therapies. 1. When you are monitoring your client who is now started on an intravenous antibiotic for an infection, you notice that the client is exhibiting signs of anaphylaxis. What is your first priority intervention? Stop the intravenous flow. Slow down the intravenous flow. Notify the doctor. Begin CPR. Answer: A. The first priority intervention is to immediately stop the flow of the intravenous antibiotic, because it is highly likely that the signs of anaphylaxis have occurred as the result of the client's adverse effect to this antibiotic. The next thing that you would do is assess the client to determine their physical status and to provide necessary emergency measures, including CPR, if it is indicated. Later, you would notify the doctor about this adverse reaction. 2. The best way to determine whether or not a medication is compatible with a particular intravenous fluid is to mix a small amount of the medication in a small amount of the intravenous fluid and then examine this mixture for color changes. Refer to a compatibility chart. Call the doctor and ask if the medication is compatible with the particular intravenous fluid. Mix a small amount of the medication in a small amount of the intravenous fluid and then examine this mixture for any precipitates. Answer: B. The best way to determine whether or not a medication is compatible for a particular intravenous fluid is to refer to a compatibility chart. Although, at times, incompatibility can be evidenced with changes such as those related to color changes and the formation of a cloudy solution or obvious precipitate, at other times incompatibility may not be noticeable. For this reason, nurses must refer to a compatibility or incompatibility chart before they mix medications or medications and solutions. Lastly, there is no need to call the doctor for compatibilities when you have, and should use, a compatibility chart. 3. One of the primary purposes of a formal medication reconciliation is to prevent polypharmacy, conserve financial resources, prevent interactions, prevent allergies. Answer: C. The medication reconciliation process to ensure that the nurse is aware of all medications that the client is taking, some of which may have been ordered by a physician other than the client's primary care doctor and some of which are over-the-counter or alternative therapies that the client has added. The complete and current list of medications is then reviewed by the nurse and possible interactions are identified and addressed with the client. Although this medication reconciliation process can also save costs by eliminating unnecessary medications, particularly when the client is taking multiple medications, polypharmacy, this is not a primary purpose. Lastly, medications that the client is allergic to should never be given, therefore, these medications should not appear during the medication reconciliation process, they should never have been given to or taken by the client. 4. Your pregnant client has a new order for a medication. What principle should you apply to this new medication? The fact that drugs classified as categories C, D, and X are contraindicated for women who are pregnant. The fact that drugs classified as categories A, B, and C are contraindicated for women who are pregnant. The fact that drugs classified as categories C, D, and E are contraindicated for women who are pregnant. The fact that drugs classified as categories C, D, and Z are contraindicated for women who are pregnant. Answer: A. Drugs classified as categories C, D, and X are contraindicated for women who are pregnant because of the risks associated with these categories in terms of the developing fetus when these medications cross the placental barrier. 5. What are the nursing implications associated with administering blood and blood products to a client who has a blood type of B negative? The nurse must be knowledgeable about the fact that this client has A and B agglutinins and lacks the Rh factor. The nurse must be knowledgeable about the fact that this client has B and O agglutinins and lacks the Rh factor. The nurse must be knowledgeable about the fact that this client has B agglutinins and lacks the Rh factor. The nurse must be knowledgeable about the fact that this client has A agglutinins and lacks the Rh factor. Answer: D. The nurse must be knowledgeable about the fact that this client has agglutinins and they lack the Rh factor. Type A blood has B agglutinins, type B blood has A agglutinins, type AB blood has no antibodies, or agglutinins, and type O blood has both A and B agglutinins. People also have a rhesus, or Rh, factor antigen or the lack of it. Clients with an Rh positive blood, which is the vast majority of people, have Rh positive blood, and people without the Rh factor antigen have Rh negative blood. 6. Select the complication of a blood transfusion that is accurately paired with its preventive measure. Hemolysis, typing and cross-matching the blood and checking for ABO compatibility prior to administration. Hemolysis, ensuring that the client does not have a prior history of hemolysis in the past. Febrile reactions, ensuring that the client does not have a prior history of hemolysis in the past. Febrile reactions, typing and cross-matching the blood and checking for ABO compatibility prior to administration. Answer: A. Hemolysis can be prevented by typing and cross-matching the blood and checking for ABO compatibility prior to administration. This incompatibility can occur as the result of a laboratory error in terms of typing and cross-matching and a practitioner error in terms of checking the blood and matching it to the client's blood type. Febrile reactions are the most commonly occurring reaction to blood and blood products administration. Although a febrile reaction can occur with all blood transfusions, it is most frequently associated with packed red blood cells, and this reaction is not accompanied with hemolysis, nor is it associated with its occurrence. 7. You will be administering packed red blood cells to your client. Which of the following principles should you apply to this blood administration? You must ensure that the client has a patent intravenous catheter that is at least 20 gauge. You will need the help of another nurse prior to the administration of these packed red blood cells. The unit of packed red blood cells should start no more than 1 hour after it is picked up. You must remain with and monitor the client for at least 30 minutes after the transfusion begins. Answer: B. You will need the help of another nurse prior to the administration of these packed red blood cells. 2 nurses must check the blood, the doctor's order, the ABO compatibility and the client's identity using at least 2 unique identifiers prior to the administration of this blood. You must ensure that the client has a patent intravenous catheter that is at least 18 gauge and not 20 gauge. You will be using normal saline and AY infusion set for the administration of the blood because Ringer's lactate and other intravenous solutions are not compatible with blood. Blood should not remain in the client care area for more than 30 minutes, so it is important that the nurse is prepared to begin the transfusion shortly after the blood is delivered to the patient care area, and lastly, the nurse should remain with and monitor the client for at least 15 minutes after the transfusion begins at a slow rate since most serious blood reactions and complications occur shortly after the transfusion begins. 8. You are caring for a multiple trauma client who has just arrived at the emergency room with a number of other external disaster victims. This client has multiple blast injuries and hypovolemic shock. It is anticipated that this unstable, critically injured, and unconscious client will have long-term intravenous therapy, blood products, and possibly hyperalimentation as well. Which type of venous access would you most likely anticipate for this client? A percutaneous, non-tunneled subclavian catheter. A peripheral intravenous catheter that is 20 gauge. A multi-lumen implanted tunneled and cuffed central venous catheter. A peripherally inserted central venous catheter. Answer: C. You would most likely anticipate that this client will be given a multi-lumen implanted tunneled and cuffed central venous catheter because this multi-trauma client is in need of multiple intravenous therapies such as blood, medications, and total parenteral nutrition over an extended period of time. A percutaneous, non-tunneled subclavian catheter would not be the device of preference because percutaneous, non-tunneled subclavian catheters are used when short-term treatments are anticipated. A peripheral intravenous catheter that is at least 18 gauge is necessary for the administration of blood, and a peripherally inserted central venous catheter would also not be the venous access device of choice for this seriously ill client who will require long-term treatments and care. 10. Your client has a doctor's order for the antihistamine medication diphenhydramine for sleep. What should you do? Question the order because Benadryl is an antihistamine and not a sleeping medication. Refuse to give the Benadryl because this medication is a stimulant. Question the order because Benadryl is contraindicated when the client has a sleep inducement disorder. Give the Benadryl because sleep inducement is an accepted off-label use of this medication. Answer D. You would administer this Benadryl because sleep inducement is an accepted off-label use of this medication. When a medication is used for any other than these established and approved uses, this usage is referred to as an off-label use. 11. Which of the following is not considered one of the 10 rights of medication administration? The right verification. The right to refuse. The right documentation. The right client education. Answer A. The right verification is not one of the 10 rights of medication administration. The verification of the doctor's order for a medication is to confirm the right paint, medication, dose, route and time or frequency. It, in itself, is not one of the 10 rights. The 10 rights of medication administration are the right, or correct. Medication. Dose. Time or frequency. Patient. Route. Client education. Documentation. Right to refuse. Assessment and evaluation. 12. The administration of an intramuscular injection to a neonate should be given in the gluteus maximus muscle, vastus lateralis muscle, deltoid muscle, the sternocleidomastoid muscle. Answer B. The administration of an intramuscular injection to a neonate should be given in the vastus lateralis, rectus femoris and ventrogluteal muscle sites and not the deltoid or the gluteus maximus muscles because these muscles have not yet developed. The sternocleidomastoid muscle is not an intramuscular injection site. 13. Which site or technique would you expect to use to administer ferrous sulfate? A subcutaneous injection site. The PQRST technique. The Z-track technique. The sublingual site. Answer C. You would expect to use the Z-track technique to administer ferrous sulfate. Ferrous sulfate IM is given using the Z-track technique to avoid the leakage and dark staining of the injection site with this medication. Ferrous sulfate is not administered with a subcutaneous injection or using the sublingual route. Lastly, the PQRST method is used to assess pain and not used as a guideline for medication administration. 14. You are precepting a new graduate nurse who will be administering an intramuscular injection to an adult client. The new graduate nurse identifies the gluteus maximum muscle by palpating it. What would you do? Allow the nurse to administer the injection. Ask the nurse to use the vastus lateralis muscle instead. Ask the nurse to verify the doctor's order again. Stop the nurse from administering the injection. Answer D. You would stop the nurse from administering the injection when you observe that the nurse has palpated the gluteus maximum muscle to determine the correct site. Intramuscular injection sites are determined by using bony landmarks and not by palpating the muscle. You would not allow the nurse to administer the injection and you would not ask the nurse to use the vastus lateralis muscle instead because nothing indicates the need to do so. Lastly, you would verify the doctor's order prior to entering the room and preparing to administer the injection and not during the time that the intramuscular site is being identified. 15. Which of the following clients is at greatest risk for extravasation? The client with heart failure who is receiving Ringer's lactate. The client with cancer who is receiving bendamustine. The client who is receiving potassium supplementation intravenously. The client who is receiving total parenteral nutrition. Answer B. The client with cancer who is receiving bendamustine is at greatest risk for extravasation. Extravasation occurs when vesicant and other vein-irritating drugs infiltrate into the tissue. In severe cases, extravasation can lead to necrosis and the loss of an affected limb. Bendamustine is a vesicant chemotherapy drug. Extravasation is not associated with the intravenous administration of Ringer's lactate or potassium supplementation intravenously because this solution and medication are not vesicants. These intravenous preparations can lead to infiltration but not extravasation. Lastly, the client who is receiving total parenteral nutrition is at risk for other complications such as infection, but not extravasation. 16. Select the complication of intravenous therapy that is accurately paired with one of its interventions. Infection, lowering the limb to promote circulation. Infiltration, the application of cold to the site. Extravasation, the aspiration of contents including blood from the forecannula. Hematoma, the administration of dexrazoxane. Answer, C. In addition to other interventions, intravenous fluid contents including blood are aspirated from the forecannula. Other interventions include immediate cessation of the infusion, elevating the limb, applying warm compresses initially to rid the area of any remaining drug that is in the tissues, which is then followed by cool compresses to reduce any swelling, and the administration of an ordered substance-specific medication such as dexrazoxane. One of the interventions for infection include the elevation, not lowering, of the affected limb. Infiltration is treated with the application of warm, not cold, compresses, and one of the interventions for hematoma is the application of pressure and heat and not the administration of dexrazoxane. 17. The Kreis scale is used to assess motor functioning, assess sensory functioning, evaluate responses to a tactile stimulation, evaluate responses to a pain analgesic. Answer, D. The Kreis scale is used to evaluate the neonate's response to a pain analgesic. This pain scale is also used to assess pain among neonates. Observational behavioral pain assessment scales for the pediatric population are used among children less than 3 years of age. Some of these standardized pediatric pain scales, in addition to the Kreis scale, include the FACES pain scale, the Toddler Preschooler Postoperative Pain Scale, TPPPS, the Neonatal Infant Pain Scale, NIPS, the Children's Hospital of Eastern Ontario Pain Scale, KEOPS, the FACES Legs Activity Cry Consolability Pain Scale, FLAC, the Visual Analog Scale, VA-SOBS, the Observation Scale of Behavioral Distress, OSBD, the Comfort Pain Scale and the Pre-Verbal Early Verbal Pediatric Pain Scale. PEPPS, that is used with toddlers. 18. Select the opioid classification that is accurately coupled with an example of it and a side effect or adverse reaction to it. Opioid agonist, dilaudid, constipation. Opioid agonist, naloxone, constipation. Opioid antagonist, dilaudid, anaphylaxis. Opioid antagonist, OxyContin, anaphylaxis. Answer, A. Dilaudid is an opioid agonist that can cause constipation. Other opioid agonists are codeine, OxyContin, Darvon, Dilaudid, Demerol and Percocet. The side effects and adverse reactions to this classification of drugs include constipation, sedation, nausea, dizziness, pruritus and sedation, respiratory depression and arrest, hepatic damage, an anaphylactic reaction, circulatory collapse and cardiac arrest. Opioid antagonists, also referred to as opioid receptor antagonists, such as naloxone and naltrexone, can have side effects such as hepatic damage, joint pain, insomnia, vomiting, anxiety, headaches and nervousness.